Welcome back to the Best PT Podcast. This is episode 4.7, talking about cardiovascular pharmacology. Starting with alpha adrenergic antagonist agents, the action here is arterial dilation. The purpose is to decrease blood pressure. Side effects include dizziness, heart palpitations, orthostatic hypotension, and drowsiness. PT should be mostly aware about the risk of orthostatic hypotension. And examples include Cardura and Minipress. Angiotensin-converting enzyme inhibitors, or ACE inhibitors, suppress angiotensin-converting enzyme with the purpose of decreasing blood pressure. Side effects include hypotension, dry cough, hyperkalemia, and hyponatremia. The main implication here for PT is hypotension. Examples include Vasotec and lisinopril. Angiotensin II receptor antagonist agents block angiotensin II receptors to limit vasoconstriction. The purpose is to decrease blood pressure and treat congestive heart failure. Side effects include dizziness, back or leg pain, and angina. PT implications, minimal. Examples include losartan and Diovan. Antiarrhythmic agents inhibit sympathetic activity of the heart with the purpose of reducing arrhythmias. Side effects include dizziness, hypotension, and the possible exacerbation of arrhythmias, so these can actually make arrhythmias worse. The PT implications here are that you have to encourage patients to not skip their medication due to the side effect I just talked about. Examples include lidocaine, atenolol, and cardizem. Anticoagulant agents inhibit platelet aggregation and thrombus formations with the purpose of thinning the blood and also used as a DVT prophylaxis. Side effects include hemorrhaging and GI distress. PTs should be concerned with possible bleeding or bruising. Examples include heparin, Coumadin, and Lovenox. Anti-hyperlipidemia agents inhibit cholesterol synthesis with the purpose of reducing cholesterol levels. Side effects include headache, GI distress, muscle pain, and rashes. PT implications are that aerobic exercise can further increase HDL levels and lower LDL levels. Examples include Lipitor, Zocor, and Tricor. Antithrombotic agents, or antiplatelet agents, inhibit platelet aggregation and clot formation with the purpose of thinning the blood or acting as a DVT prophylaxis. Side effects include hemorrhaging, liver damage, especially with aspirin, and GI distress. PT implications, bleeding and bruising. Examples include aspirin and Plavix. Beta blockers decrease heart rate and heart contractility with the purpose of reducing the myocardial oxygen demand. Side effects, bradycardia, fatigue, depression, blurred vision, and dizziness. PT implications are that heart rate and blood pressure response to exercise is paradoxical and they need to use RPE with these patients. Examples, atenolol and Lopressor. Calcium channel blockers decrease the transport of calcium to vascular smooth muscle with the purpose of decreasing myocardial oxygen demand. Side effects, dizziness, headache, hypotension, and peripheral edema. The implications here are the same as beta blockers. Heart rate and blood pressure response to exercise is paradoxical, so use RPE. Examples include Norvasc, Procardia, and Cardizem. Diuretic agents increase excretion of sodium and formation of urine with the purpose of decreasing blood pressure. Side effects include dehydration, hypotension, cardiac arrhythmias, and polyuria, or peeing a lot. PT implications are muscle weakness and cramping due to dehydration and hypotension. Examples include thiazide and Lasix. Nitrate agents are smooth muscle relaxers causing vasodilation with the purpose of decreasing myocardial ischemia. Side effects include headache, dizziness, and orthostatic hypotension. PT implications, orthostatic hypotension, as well as that you should be aware of which patients are prescribed nitroglycerin and ensure they have it with them before you begin physical activity. Examples include nitroglycerin. Positive inotropic agents decrease sympathetic nervous system activation and decrease conduction velocity of the AV node with the purpose of increasing the force and speed of heart contraction in order to slow heart rate. Side effects include arrhythmias, GI distress, dizziness, and blurred vision. PT implications, closely monitor heart rate. Examples include digoxin. And finally, thrombolytic agents accelerate the conversion of plasminogen to plasmin with the purpose of busting clots. Side effects include hemorrhaging and allergic reactions. PT implications: avoid situations that will cause trauma due to patients' inability to form clots. Examples include activate or alteplase or simply TPA. That's it for episode 4.7 talking about cardiovascular pharmacology. The next episode, 4.8, will talk about cardiovascular procedures. As always, the outline will be in the show notes. Thanks for joining me.